Next question, the Honorable Member for Muchinga.
Thank you very much, Madam Speaker. Once more, question number 127.
The Acting Minister of Labour and Social Security.
Thank you very much, Madam Speaker. The Honorable Member, Mr. Emmanuel Banda, from Chinga Parliamentary Constituency, asked the Honorable Minister of Labour the following question. A, whether government is aware that the former workers of Southern African Alloys Limited in Serenge District who got sick due to exposure to manganese dust and were discharged on medical grounds are living in destitution as they are paid only 600 kwacha per month as compensation by the Workers' Compensation Fund Control Board. Madam Speaker, the response. Government, through the Ministry of Labour and Social Security, is fully aware of the incidents involving the Southern African Ferroalloys Limited, SAFAL, workers. The Workers' Compensation Fund Control Board, the board, received a report in line with Section 88(1) of the Workers' Compensation Act number 10 of 1999 of the laws of Zambia on the incidents of an occupational hazard relating to exposure of workers to manganese dust involving a total of 27 workers from SAFAL. Madam Speaker, the board subjected the victims to medical examinations at the Occupational Safety and Health Institute, OSHI, in Kitwe, and the University Teaching Hospital, UTH, in Lusaka, for assessment of the degree of disablement suffered for the purpose of awarding compensation. The said assessments were done, and the board computed the compensation due to each of the workers using a predefined formula as prescribed in the Workers' Compensation Act number 10 of 1999. You may wish to note, Madam Speaker, that the compensation paid by the board is based on the degree of disablement as determined by competent medical staff. The compensation awarded to these workers is 50% of the assessable income, which currently stands, or at the material time, stood at 1,200 kwacha. The victims were awarded compensation in form of cash and comprehensive medical care according to the degrees of disablement suffered and as indicated below. 13 are receiving a total compensation of 2,175 kwacha, broken down into a monthly pension of 675 kwacha and a constant attendance allowance, CAA, of 1,500 kwacha. Second, there are 2 of them who are only entitled to monthly pension of 591 and 506 kwacha respectively. In addition, they are paid the aforementioned CAA of 1,500 kwacha. Third, another 2 are entitled to a monthly pension of 675 kwacha and 607 kwacha respectively. Fourth, and the further 2 are entitled to monthly pension of 384 kwacha and 337 kwacha respectively. Fifth, another 6 are entitled to monthly pension of 300 kwacha. And then finally, 2 are yet to be assessed at UTH as be assessed, as UTH has not provided the results of the occupational disease that they suffered because it is a novel type. Madam Speaker, constant attendance allowance, CAA, is a disability benefit designed to facilitate for daily care for the highly or severely disabled beneficiaries that require constant support, which means for those highlighted above, Madam Speaker, if they are not receiving CAA, it's because they do not require constant support. Over and above that, Madam Speaker, the Workers' Compensation the Workers' Compensation Fund Control Board does not only provide the cash benefits aforementioned, but also has ensured that all victims are placed on a scheduled UTH evacuation program for medical care and physiotherapy, and all costs relating to the aforementioned, which include transport, food, lodging, and prescribed medicines, are met by the board. The costs of medical care are not capped. Madam Speaker, I thank you.
Supplementary questions. The Honorable Member for Muchinga.
Thank you so much, Madam Speaker. I must mention in the first place that I have met these people several times to understand how they are coping up with life after they were weaned from the company, or rather dropped from the company payroll. What I've observed, Madam Speaker, contrary to what the minister said, is that there are only two payment systems. The most severely hit are paid 600 kwacha per month, while those in the category where they are regarded as a bit better, they are getting 120 kwacha monthly. And also I heard the minister talking of the CAA, that is something like 1,500. I have never heard of anyone among the sick getting this 1,500. Therefore, my question, Madam Speaker, is looking at the way these people are, if you were to meet them, why can't government come in to call the company that formerly employed them and the sick people, so as to find a solution, or rather a way in how, on how maybe the company can still continue helping these people while we are waiting to have that act amended so that these people are taken care of? Because currently the situation is not good, you know, the way these people are living, the way they are, you would feel bad. Madam Speaker, I thank you.
The Acting Minister of Labor and Social Security.
Thank you, Madam Speaker. Madam Speaker, the information that has been brought forward is based on records. I would urge the Honourable Member of Parliament, in the goodwill that he is executing, to also take the further step of not just listening to one side of the story, but equally checking with the Workers' Compensation Fund in terms of the records that are available for payments that are being made. If it is then found that the records do not reflect that payments are being made as required by law, then it would entail that a further step should be taken to ensure that lawful payments are made.